Welcome to our Health Talk. Today, we dive into a significant health topic, chronic kidney disease, also known as CKD. Imagine a pair of organs, your kidneys, that quietly and efficiently filter waste from your blood and regulate your body's fluid levels. Now imagine if these vital organs didn't function properly. That's chronic kidney disease for you. It's a long-term condition where the kidneys aren't performing at their best. This condition is more common among older individuals, and interestingly, those of Black or South Asian origin tend to have a higher incidence. However, it's important to remember that CKD does not discriminate and can affect anyone. Remember, CKD can worsen over time, but many people live long lives with the condition. Now you might wonder how to know if someone has CKD. Let's unravel those details. Chronic kidney disease, or CKD, is a tricky condition. It's much like a stealthy cat, quiet, elusive, and often going unnoticed until it pounces in the advanced stages. This is primarily because the symptoms of CKD can be quite subtle and may not appear until the disease has significantly progressed. In the early stages, one might not experience any discomfort. As the disease advances, symptoms may include fatigue, frequent urination, especially at night, swollen ankles, feet or hands, shortness of breath, and even blood in urine. However, these symptoms are quite common and can be associated with various other health conditions, which makes CKD harder to identify based on symptoms alone. So how is CKD diagnosed? The answer lies in routine health checks. Blood and urine tests are the primary tools in diagnosing CKD. Blood tests measure the level of certain waste products like creatinine and urea. High levels of these substances may indicate that the kidneys aren't functioning properly. On the other hand, urine tests help identify whether there's protein or blood in the urine. Healthy kidneys typically don't allow a significant amount of protein to pass through to the urine. If the tests show protein in the urine, it could be an early sign that the kidney's filters have been damaged by CKD. The severity of CKD is usually determined by a number scale based on these test results. This scale allows physicians to stage the disease and plan the best course of treatment. The silent nature of CKD makes regular health checkups crucial. So remember, maintaining a routine of regular health checks can help in early detection and management of CKD, keeping this stealthy cat from pouncing unnoticed. It's essential to understand what causes CKD. Here's what we know. Chronic kidney disease, or CKD, isn't an ailment that just pops out of thin air. It's usually a long-term consequence of other underlying health conditions. It's like a shadowy figure that lurks behind the scenes, only revealing itself when these other conditions set the stage for it. One of the main culprits is diabetes. High blood sugar levels over a prolonged period can damage the kidneys, making it harder for them to filter out waste from your blood. Over time, this can lead to CKD. High blood pressure is another common condition that can cause CKD. Just as a water hose might burst under too much pressure, your kidneys can also suffer damage if your blood pressure is consistently too high. This damage can disrupt the kidney's filtering process, potentially leading to CKD. Certain inflammatory conditions like glomerulonephritis can also cause CKD. Glomerulonephritis affects the kidney's filtering units, the glomeruli, causing them to become inflamed. This inflammation can hinder the kidney's ability to filter waste and excess fluids from your blood, which can result in CKD over time. Some people are also at a higher risk of CKD due to genetic factors. For instance, polycystic kidney disease is a hereditary condition where clusters of cysts develop within the kidneys, impairing their function and possibly leading to CKD. And lastly, long-term use of certain medications, particularly those for pain, can also damage the kidneys and lead to CKD. It's important to remember that these are just some of the many potential causes of CKD. Every individual's body is unique, and the way these conditions interact with each other can vary widely. Addressing these underlying conditions can help prevent the onset of CKD. While there's no cure for CKD, there's much we can do to manage it. Chronic kidney disease, or CKD, may sound daunting, but with the right treatment and management, it's possible to slow its progression and manage the symptoms. The cornerstone of CKD management lies in lifestyle changes and medication. Let's delve a bit deeper into what these entail. Lifestyle changes are pivotal in managing CKD. These changes are often simple, yet they make a significant difference. They include maintaining a balanced diet, limiting alcohol intake, avoiding smoking, and staying physically active. A balanced diet is key to keeping CKD in check. This means consuming a variety of foods in the right proportions, including plenty of fruits and vegetables, lean proteins, and whole grains. It's also crucial to limit salt intake, as excessive salt can increase blood pressure, putting extra strain on the kidneys. Limiting alcohol intake and avoiding smoking are equally important. Alcohol can raise blood pressure and harm the kidneys, while smoking can speed up the progression of kidney disease. Physical activity is also crucial. Regular exercise helps maintain a healthy weight, reduces blood pressure, and strengthens the heart, all of which are beneficial for individuals with CKD. On top of lifestyle changes, medication plays a significant role in managing CKD. The type of medication prescribed often depends on the underlying condition causing the CKD. For instance, if high blood pressure is the culprit, blood pressure-lowering medications may be prescribed. It's also worth noting that regular checkups are recommended for individuals with CKD. These checkups allow healthcare professionals to monitor the disease's progression and adjust treatment plans as necessary. In some severe cases of CKD, more intensive treatments may be required. These could include kidney dialysis, where a machine does the job of the kidneys, or even a kidney transplant. While the journey with CKD can be challenging, remember that you're not alone. Healthcare professionals are there to provide support and guidance along the way. Though CKD can range from mild to severe, with the right approach, it's possible to live a healthy life. With lifestyle changes, medication, and regular checkups, individuals with CKD can manage their condition and continue to lead fulfilling lives. We've covered a lot of ground on chronic kidney disease today. Let's take a moment to recap the essential points. Chronic kidney disease, or CKD, is a long-term condition where the kidneys do not work as well as they should. It's more common as we age, and in individuals of Black or South Asian descent. But don't be fooled, it can affect anyone. Remember, CKD is a silent condition. Symptoms may not appear until it's advanced, which makes regular blood and urine tests vital for early detection. And if you're wondering what causes CKD, it's usually a result of other underlying health issues. So managing your overall health is key to prevention. Despite there being no cure for CKD, it doesn't mean you can't live a long and fulfilling life. Treatment focuses on managing symptoms and slowing down progression. Regular checkups with your healthcare provider, staying active, eating a balanced diet, and taking prescribed medication can go a long way in managing this condition. But remember, CKD can increase your risk of developing cardiovascular disease. So alongside managing CKD, it's crucial to keep an eye on your heart health too. Knowledge is our greatest weapon against diseases like CKD. By understanding this condition, its causes, symptoms, and how to manage it, we can make informed decisions about our health and help others do the same. Was this video informative? If so, show your support by subscribing, liking, and commenting. And don't forget to share this video with others. Together, we can spread knowledge and promote healthier lives.